Well, hello, and I thought today that I would give you a quick video that introduces you to some of the websites that, as a good healthcare practitioner, you should have in your quality improvement toolbox. These would be ones that I'd recommend you bookmark, and I would recommend that you visit them on a fairly regular basis. And the other reason I wanted to have my camera up, besides to say hello, is to show you my beautiful location here. I know that some of you are from far away from Boise, but we are blessed to be in a place where we have the four seasons, and I'm right on the Greenbelt in Boise. We're right next to a river, the Boise River, and the downside of having this here is, unfortunately, you have to watch me on camera now, so I hope that it's pointed the right way. If it's not, I guess that's okay too, and what I want you to focus on is your screen. So the first website I want to introduce you to, if you haven't visited so far, is the Agency for Healthcare Research and Quality. We'll be using some of these resources. This week, I bet you hear more about these types of agencies. This one has access information for patients, for policymakers, people who are on legislative committees can get information here. The one we're interested in here is for professionals, and they have a very good search tool, or you could look for items. This week I'm going to have you look at some of the benchmarks from the Agency for Healthcare Research and Quality. And the thing I like about it is when you bring these up, it will show you the breadcrumb trail, they call these, for how they found the information, so I can see which section it's located in next time, and you can see that they have a whole section for quality measure tools and resources. So if you're participating in quality improvement in whatever occupation you're involved in, you may check here to see if there are benchmarks or measurement tools that have already been developed. All right, Agency for Healthcare Research and Quality, ahrq.gov. The next website that we're going to go to is, let's go to Joint Commission. So those of us that work in hospitals know that when Joint Commission comes, we do everything by the book. And unfortunately, we all hope that we do things by the book when Joint Commission isn't there. But it is kind of amazing how practice may change depending on who's in the hospital watching us. And I would hope that we're all capable of performing ethically, meaning that it doesn't matter who's watching, we do what's right for the right reason. All right, so at the Joint Commission website, the main tool that we're going to use is this resource right here called Quality Check. You can get to it a couple ways. Do you see that they have their top links up here? I'm going to have you look at their key quality measures this week. So that would be a piece that we'll have. And Quality Check. So I ask you in the assignment this week to quality check a local hospital or the one that you work at. And I give you some instructions within the assignment document. What I'm going to do here is just show you, because I think sometimes it's easier once you see it to be able to do it yourself. And isn't it interesting that even though you put in Idaho, see, it brings up a home care company not called what I want. However, it's within it. So I'm going to scroll down because St. Alphonsus has multiple facilities, but the one I want is their main facility that's located in Boise, Idaho. And when you find your facility, would you do either view certification quality report or view accreditation quality report, either one of those. And when you scroll down, do you see they tell you the goal or the benchmark? It's then very easy to see if the facility met the benchmark or exceeded the benchmark or was below it. Can you see the symbol key to find over here? It tells you a gold star. Let's find a gold star one. And I know coming here before, I'm going to go into this one and I'm going to look for detail on the infection control. So SCIP. So Surgical Care Improvement Project is one of the goals, and it tells me the reporting period. And if I look, do you see that they actually had 100% of eligible patients, and they'll tell you what the N or the number of patients is. But a gold star, just like I guess being a student, you want to earn a gold star. Every hospital wants to earn a gold star. However, a plus is the next best thing. It says you were above the target range or value, and it's telling you what that target range is here, the threshold. And you can see if they were similar to the target range or value if they get the blue check mark. So pluses, the more pluses and gold stars you have, the more that you've exceeded the set value. And we're talking about benchmarks this week. They're telling you here that where the average rate is, where the top 10 scored, top 10% in the nation scored statewide and nationwide. I'll give you those results if they have them. The next thing you can do is go in to get more detail. So let's go to the one where they fell below, and I could read more. So it says, on large intestinal surgery, they are below threshold for the number of patients having to have this procedure done. Okay, so it's helpful to be able to go in and quality check basically any hospital in your area or out of the area. This could help you or family members when you're looking at a new facility. If you're looking for employment and you know that you're going to be in a certain city, you could maybe compare hospitals in that city to see which one meets these guidelines better. The other website, and that was the Joint Commission, and one of the tools that you can use at the Joint Commission website is a tool called Quality Check. It was really set up for consumers to be able to check hospitals, but I know that a lot of healthcare providers do that as well. I know personally I do that. The next website is Medicare.gov, and even if you're not a Medicare patient, there's lots of helpful information here. But the tool that I'm not having you use this week, but that you could use and that I've used before and would recommend, and the reason it's in our toolbox, is they have a similar tool to Hospital Compare. Oh, theirs is called Hospital Compare, and the other one's called Quality Check. So let me see. I thought I was all ready to do this. And now I have to find, let's see, Hospital Compare. I know that there's a link to it, but I guess I can get there this way. So Hospital Compare Quality of Care, and when I get to this piece, so theirs is called Hospital Compare, I could put in a city or state. So my mom and dad are snowbirds, meaning that they live in Idaho part of the year, and when it gets cold in Idaho, they migrate to Arizona, and they live in a little place called Quartzsite, which is a remarkable place because it goes from nothing to this full city of people that live in motorhomes. They happen to have a trailer and a park down there, but it is amazing. The whole desert comes alive with these people that are in their motorhomes, and they live there for the winter season. So Quartzsite, Arizona, what's the purpose of doing this? It's to say, my dad called and his physician said, I need knee replacement surgery and I want to have it done while I'm down here where it's warm and I can walk around without problems. So I could check and see who does that procedure, and I could compare hospitals. What if you're out of town and you have some sort of condition where maybe it's not extremely emergent to where you have to run to the emergency room right now, but you want to be able to check out what hospital should I go to with this condition if I have some time or the luxury to be able to do that, or just to give family members information, such as the example I shared with you about my parents. So let's check out Medicare.gov Hospital Compare. It's come up with some hospitals that are close to my parents. It tells me the distance from them. It tells me if they have emergency services. It tells me what kind of hospital they are. And I can choose up to 3 of these, and it will remind me at the bottom, if I can get there, it will remind me that I can choose up to 3 hospitals to compare. So let's compare. I know that one hospital they go to quite a bit is Yuma Medical Center. Let's say they also don't mind traveling to Havasu. That's a good place to do spring break. If you've never been there, that's quite an eye-opening. People bring their boats to the lake, and there's lots of muscle power and lots of mussels. So I'm going to add Palo Verde Hospital also, which is in Blythe, not too far away from them. In fact, that's one of the closest to their area. And let's do a compare then. So when I go down here, I will be able to compare those three hospitals, and I can choose which results I want to compare them on. So patient experiences, do I want to look at that? Do I want to look at facilities and what they offer? Do they use the safe surgery checklist? Do they check lab results? Can I look electronically and be able to see my own results? Maybe that's important to me because I'm a snowbird and I migrate between one place and another, and if I could receive my lab results electronically, I could take those to my healthcare provider when I'm in Idaho. These things then, I can compare those hospitals, and it will bring up more detail as I go to them. I can choose to review it in table form, or I can have it show it in graph form. And it will show me benchmarks for those things and where these hospitals fall out. Some of them will just say, hey, they don't have patients that met the criteria for that measure. It will let me look for the complication rate. Why is that important? So let's say my dad's going to have knee replacement surgery. This tells the patient that the lower percentages are better. So it helps even healthcare providers who it doesn't hurt to help us know what kind of data am I looking for. And I could say, hey, Dad, there really wasn't that much difference. However, if he's really worried about complications for his knee replacement, then I might say go to Havasu. Some people might say these compare sites are not really comparing apples to apples, because what if you were the referral center for a lot of smaller hospitals where they send their most difficult cases to you? Can you imagine that your data may not look as well as some hospital that's a for-profit hospital that can kind of pick and choose the patients that they take? So these are not the end-all be-all. However, they are useful tools. If you think about it, we can shop around for cars. I can compare cost for the same model of car from a number of providers. And there are people who say, why can't we do that with healthcare? But that makes sense to you too. Why can't I find out how much a procedure is going to cost me in advance and know that going in, that here's how much I can anticipate I'm going to pay for that. Here's I should be able to ask for quality data and be able to see that, and now I can do that online. So whether it's fair or not, we're moving towards letting people be able to comparison shop when it comes to healthcare, just like they can with everything else. So I hope that you found these three websites helpful: Medicare.gov, the Agency for Healthcare Quality and Research, and the Joint Commission for Accreditation of Hospitals website. Hope you'll put those in your toolbox. It's been nice visiting with you today, and I hope that you're having a good Wednesday. I'll see you and get this published.